Good afternoon. I'm Cherie the Patient Healthcare Liaison for the Multiple Sclerosis Foundation, and I'm joined today by two of our potential three panelists. Tim has not yet arrived. Hopefully he will log in shortly, but we're going to be sharing with you, since most of us are approaching 7 decades of life and have lived much of that time with MS, we kind of wanted to share some tips and tricks for successfully getting to this point in our life with MS. Um, for those of you that don't know me that are online, I had my first hospitalization with what we now know was MS in 1975. So that means I'm 49 years in. I wasn't diagnosed for 19 years, and my diagnosis came right after our first medication came on the market, and it was only for newly diagnosed individuals and not newly diagnosed, but new to MS individuals. So I did not qualify for it. When I finally got into an MS specialist 6 years later, he did start me on one of the three disease modifying therapies that is currently on the market, or was currently on the market at that point. And a couple of years later, I went to the next newest one here in the United States. And that kind of was a rescue drug for me. Um, it got me out of my scooter. I was scooter dependent for more than just a few feet at a time. Okay, I hear Tim is on, but he can't get his audio and video to come up. So maybe Bhavya, who's doing our technical work behind the scenes, can help out. Thank you very much. Um, we're looking forward to Tim coming on. Uh, so we will be sharing with you some of the tips and tricks besides disease modifying therapies, or in addition to that, we have found to work well for us. I'm joined right now by Seth Morgan, who is retired from his neurology practice due to MS, and Bernadette Ferry, known as Bernie to those who know and love her, who is a retired RN who's also living with MS for years. So, why don't we do ladies first and let Bernie take a moment to introduce herself?
Okay. Do you want me to give my story, or what do you want me to?
You can go ahead and give your story. Take maybe 5 minutes if you need
Okay.
to, and compress it to that, and then we'll get into some questions and answers and that sort of thing.
Okay. So I was diagnosed in 1990. I was working at the time as a labor and delivery nurse. I did not get put on any medications until after my first relapse, which was in 2001. So at that time, I started taking medications. I had no um, issues really for those 11 years. I really had no symptoms at all. Um, from there, I continued working. I continued working through one more exacerbation, which at that time the last one that I had was in 2014, and that was the time that I had to stop working. I ended up going to PT for quite a while. Started using a cane, and of course, once with the cane, that was not going to work with trying to be a nurse. It was impossible to run around the unit. So at that time, I stopped working. Um, I joined the MS Dream Center, which is a program we have here in Rhode Island, and that's where I still am doing that 4 or 5 days a week, taking my medication and using now a walker, but that's about the only thing. I'm still driving, still doing what I want to do just with the help of the walker, or if it's really going to be something more than I can do, someone will have to use a transport chair, take me that way. But other than that, I try to keep going.
Thank you. I see Tim is trying to log in under Sharon's name, so while he's getting those issues ironed out and getting on camera and microphone, we'll let Seth take a minute and introduce himself and a little bit about his MS journey.
Yeah, thank you very much. Yeah, I am a neurologist by training. I call MS my 50th birthday present. I'm now 20 years in. And before that, of course, I had studied MS extensively. I had multiple patients in my practice, which spanned about 20 to 23 years. Um, and I had the unfortunate experience of actually diagnosing myself, which is something I don't recommend to anyone. At the time of my diagnosis, which is now 20 years ago, there were medications, of course, but they were all injectable. And I hate to say this, as much as I understand the need for it, I was not a fan of injectable medications. Nonetheless, I stayed on injectables for 2.5 years. I was on beta-seron every other day, and I didn't find that it was particularly helpful to me. But as based on my training, I realized I needed to be on something, and I kept going with it. And finally, I just gave up and I decided I could not take any more injections after 2.5 years of this. And I went to my neurologist because I'm very careful not to be my own neurologist. That is an important thing. And I said to him, I need to be on something, but I realize I'm not, I won't go on any other injections. And he said, well, there's a study being done on the first available oral agent. Would you like to consider being considered for that? And yeah, sure enough, I was one of the individuals in the original Gilenya study back when it was called fingolimod. I was on that from the first, and then I was in the extension study, and it did very well for me. Actually, my son commented to me how much better I was doing with it. I was still dependent on a cane at that point, so I was still needing some support. I subsequently came off of Gilenya because of an intercurrent illness, and currently I'm not on any DMTs. I am being considered for addition of a DMT at this point, but I'm still, everyone's a little bit gun shy because I had cancer in the interim, a lymphoma, and it hasn't been an easy decision to make whether to go on an agent or not. But that's me in a nutshell.
Thank you. That's quite a journey. Tim, would you take a moment and introduce yourself to us and tell us a little bit about your MS journey, how long, what you've done to manage it, that sort of thing?
Okay, hello everybody. Sorry it took a while to get everything straightened out. My phones are all over the place and calling, it cuts off, and you name it, it's a problem. My name is Tim Carr. I am retired. I was a television news reporter for 30 years. I retired in on 2002 or 2001, somewhere in that area. I'm not sure, it's all over the place. I was diagnosed with MS in 1998. For 20 years was doing, I was injecting myself with a needle with Avonex. I did Avonex and only Avonex. Then about 5 years ago, I started with Empira now, which is what I do now, is Empira, or some people call it Empira, I guess. Basically, my progress has gotten to the point that right now I think I'm considered primary progressive MS. I have walking problems. I just started using a cane 2 years ago. And right now I'm seeing a physical therapist to try to get that straightened out. And when I walk, my left knee goes backwards. It collapses backwards. So we're working on some stuff to kind of straighten that out and strengthen my thigh muscle or left calf muscle, and which I'm doing right now. I just started doing that recently. But generally, over the years, I probably have had just about every symptom. The numbness, I lose my voice sometimes in the evening, which my wife likes. But that's neither here nor there. My sight, I've got a couple of other problems to go along with my MS, including diabetes. I have diabetes. I also have glaucoma and cannot see out of my left eye. So that's another thing to add to my woes and worries. And every morning I take at least 8 different medications. A few for the diabetes, my MS, as well as I do eye drops, 2 different eye drops for the glaucoma. And I'm a mess, basically. I still play golf twice a week, Monday and Friday. And my wife, when she retired, she's joined me. Now she's become a golf hound. She loves it. She wants, in fact, I got a tee time for tomorrow. But I'm still physically able to get around. I do still use a cane when I'm walking any distance at all. I don't use it around the house or anything. And I've also resolved that if I ever need it on a golf course, I'm going to stop playing golf because I'm not taking a cane on the golf course to walk or doing anything. But I've discovered something using the cane. It's something interesting. You can draw a lot of people to just drop your cane, let it hit the floor, and everybody comes over there. Everybody, including kids, want to help you pick up your cane. So that's a good way to draw attention if you want it. But I'm doing okay. My wife's a big part of it. She's kind of keeps me on the straight and narrow and makes me do things I need to do. All my doctor's appointments. She's my Uber and gets me to where I need to go. And because I've stopped driving, but I also next week have to go in because I have to renew my driver's license. So the only problem I see with that, I'm going to turn 70 on the 20th of this month, my 70th birthday. And the only thing is I'll have to do an eye test, and I don't know if I'll be able to pass the eye test at all, but we'll see. Because they told me that if I hadn't had any tickets or violations or anything, I don't have to do the written test. Plus being 70 years old, I guess that's a perk. But that's what they said, and I got an appointment to go get my driver's license renewed later on this month. But other than that, everything's good. Things are going well. We're getting ready to go to Palm Springs. Palm Springs is about a 2-hour drive from here, from San Diego. And so we usually do that every year around Thanksgiving. Our family, our kids, I have 2 kids, and they have 2 kids each. So we stay in 2 villas, Marriott villas in Palm Springs. The villas are big. They basically sleep 8 people, each one. And they come with all the amenities, the cookware and everything but food, dishes and plates and everything else. So we basically just got to go to the grocery store when we get there, and we're good to go. And we can play golf, which we'll do as well.
Cherie, do you mind if I jump in just for a moment for
Please.
Tim? In terms of your driver's license, what I do, because certainly I have to get my eye examined for that. If you have an ophthalmologist, they can give you the most recent eye exam, and based on that, you should be able to either get it or not based on what they find on that. So you don't have to worry about taking any more eye exams at the DMV. Just a suggestion.
Yeah. I'm hoping that when they if they do have me do the eye exam at the DMV, that they don't make me cover my right eye. because I cannot see anything. It's light, it's not like dark and blacked out, but I can't recognize my wife standing 5 feet away from me because it's
Yeah,
that,
they do it with both eyes, Tim.
okay, if they
So
do it,
it's you look into a viewer and you're
mhm.
able to, I know I have limited vision in my left eye too, but if I cock my head just right, I can get all
You
the
can get it. Well, if my right eye is open, I can see pretty well. I have a implant in my left eye. The ophthalmologist put an implant in my left eye to stop the loss, to release the
pressure, the fluid
pressure in my
with the
eye.
glaucoma.
And
And
just a
that's what
clarification on that, in the chat, it was pointed out that it's state dependent, so you have to check what your state will or will not accept. So,
Mhm. We heard Tim talk about his golfing, and Bernie talked about a little bit about her 4 to 5 days a week at the MS Dream Center. Um, the MS Dream Center is an organization that was dreamed up by Marie Perna, a mutual friend of Bernie's and mine. Um, who has primary progressive MS, and she was hoping to develop or provide a place where people living with MS can gather socially. People with MS put on the programs. There are exercise programs every day, many of which are live streamed across the country. There's also a number of programs that increase our awareness of or knowledge of how to manage our MS. Bernie, is there anything else you want to say about the MS Dream Center? Oh, you're muted. You're muted.
Yeah, we have a neurologist that comes in once a month. We have a book club, art classes, Tai Chi, loads of different things. If anybody's interested, you can look up MS Dream Center. It's in Rhode Island. And like Cherie said, we have live stream all our exercise programs and everything. So anybody who's interested, just sign in and join us.
Bernie, is there anything else that you do for fun outside of the Dream Center on a regular basis that you feel keeps you involved in life with others?
Well, I belong to TOPS. I don't know if anyone's familiar with it, but it's kind of like a weight loss, kind of like a Weight Watcher type thing. It's a support group, and I do attend that, so I have a lot of friends there. And I spend time with my children and grandchildren. I have one granddaughter who's sings with an Elvis tribute band, so I try to get to see her as often as I can. But yeah, those are my main three things: my family, my MS Dream Center, and my TOPS program. Those are my three main.
What about you, Seth? I know that you do some advocacy work, but is there anything you do for fun besides that?
yeah, actually, it's part of my maintenance therapy, although I consider it a lot of fun. Because I enjoy it. I also do not drive anymore, but I am fortunate enough to live in an area where you can walk to things without too much of a burden. It's about 4 or 5 blocks. Uh, Pushed, I could probably go a half mile if I needed to. And I use two walking sticks, basically the same thing that people used when they were skiing, ski poles with tips on them. And I do wear a leg brace, but basically I try and stay as active as possible. And that means I live just outside of Washington, D.C. I'm in a suburb of Washington, D.C. So it's not uncommon for me to get a message, at least it wasn't before the whole issue of the problems on Capitol Hill, that I would be asked to show up on Capitol Hill to either support something or on rare occasions give testimony on something.
We may get back to that point a little bit later in the webinar, given uh, given what's happened in the past week.
Yeah.
So I may turn it over to you to share a little bit more about what all that is doing. Um, I think I'm the oldest on this call. I'm well past 70, but I'm still keeping active. For my 40s and 50s were really awful, really not good at all. I had so many overriding MS symptoms because of all of the years of not having anything to address it with. Like Seth, I didn't find the and Tim, I didn't find the Avonex to be all that helpful. I wasn't really doing great with the Avonex. Then Rebif came on the market, and it was 4.5 times the weekly dose of what Avonex was. And for me, that seemed to be enough to push me a little bit over the edge. And as I said before, it was kind of a rescue drug for me. Um, I I can't imagine going back to injectables on a regular basis after after having been on Rituxan, which is basically a twin to Ocrevus and Briumvi. Um, I was on that for 10 years, and literally that alleviated and got under control a lot of the symptoms that I was having, to the point where I could really get back to work. I kind of eased into work with my work with I Conquer MS, where I met Seth. We were both part of the research committee for I Conquer MS, which is a patient-powered research network, um, trying to drive research that's important to those of us living with multiple sclerosis. And then I got into some other research organizations as a research reviewer and ambassador. So I work with PCORI and also PCORNet, which is a network of clinical research networks across the United States. We've got over 80 different research sites. So I've worked with them pretty regularly. I've been an advocate, or not an advocate, an advisor for the National Aging Initiative for older adults with multiple chronic comorbidities. And for the last several years, I've been the patient healthcare liaison for the MS Foundation. So I consider myself to still be working half to full time, given what's going on in any given week. I haven't had a single day off in 14 days. Wednesday will be my first day that nothing's booked. So I I don't do a lot recreationally, but like Seth, I live in a small town where everything is within walking distance. We have live theater, improv, comedy, 2 blocks from my house. We've got all kinds of eateries within easy walking distance, and we've got a wonderful paved bike path that goes behind my house that goes from the train station to the beach, which is 9.5 miles. We're about 7 miles from the train station and 2.5 miles direct walk to open Atlantic Ocean. So that's kind of what what I do. We're gonna just take a few more minutes on a couple of issues, and then I'll let you all know um, how to ask your questions. Uh, One of the things that Bhavya suggested when Bernie was talking about the things that were going on at the Dream Center is that the MS Foundation also does Tai Chi and yoga classes virtually, and we stream them every week. We also have art classes. Um, so there's a whole list of things. If you go to msfocus.org and look at events or look at activities, you'll see the list of those come out. Um, Yesterday, Actually, let's go back a little bit on lifestyle changes. I don't know if any of the three of you have instituted any lifestyle changes other than, as Bernie mentioned and as Seth mentioned, extra movement, purposeful movement, exercise, that you want to share with the group. Anything that you feel that's allowed you to get where you are today, living healthfully with MS.
I went to my physical therapist, and my balance is shot. I can't stand on one foot for more than 2 or 3 seconds. So she's given me some exercises to try to get my balance back, including just standing with my feet together for 30 seconds if I can. And generally that's impossible right now. Excuse me. And in golf, you need balance. That's my
Mm-hmm.
problem is, I hit the ball and almost fall over after I hit it. But I've also lost a lot of weight in the last couple months. I weigh what I weighed in high school 50 years ago. Um, and that's another thing because I lost not just fat and water, but also muscle. So I'm working on that as well because muscle is shot. I hit the ball straight, but not long. But I'm still having a good time, and I'm a pretty good putter. But generally, I'm doing the exercises. In fact, I go to the physical therapist weekly, and she'll give me something else to do as I try to get my balance back for one.
Mm-hmm.
And many years ago, I went and spoke to the police department about MS. In fact, it was a training session they had. And I told them, if you stop somebody and you give them the drug test, the walk, the sobriety test, if they have MS, they're not going to pass most likely because I can't walk a line. I can't stand straight and, do all the finger stuff that they do. But the whole purpose was to tell them to consider MS, that person's not drunk and they weren't drinking and driving. So that's something that they need to put in their thoughts when they stop somebody and they can't pass the alcohol test or the drunk driving test. But that as well. But I've also, in fact, if you look on YouTube under MS awareness, I participated in a video shot 2 years ago where they had 4 people in various stages of MS with various situations talking about what MS means to them. And one of the things I did, and actually they shot the video up in LA in a production house, and they had me talking to a camera about MS, about things. And one of the questions was, what would it be if a house had MS? And I described what the house would be like. The windows would be clouded over, the faucets would be leaking, and everything would be crooked. The floors would be, the doors would be all off kilter. And what they did was, and that was just talking to the camera. I didn't, and then they had me looking around doing all this and that, not looking at anything in particular. Then what they did when they made the video, they used, it's called CGI, computer generated images. And they made a house around me. And when I was talking about all those things, that came up, those were in the video, which you'll see on the video. If you go on YouTube and go under MS awareness, you'll see my video. I'm in there actually with 4 other people who I never met, never saw them do their parts. We all did it at different times, but that was something that was pretty cool. Actually, it showed across the country. In fact, I had a call from relatives in Indiana who asked if that was me. People didn't know, and but I get that now and then. But I've also written a book back in 2018. It's called Me and MS. And I get calls from people thinking, is it me and my mistress? And not, they don't know what MS is. And so they look at that's actually you can get it on Amazon. And what I did with the book was when I was first diagnosed, I started a journal on my computer about different things that happened with me, MS related. And I put something in it. Usually I was doing it daily. Then I started doing it weekly. Then I started doing it monthly. Then I started doing it when I thought about it. And I took those excerpts from and my wife kept, I don't want to say badger me, but she kept pushing me to do a book. So what I did was I combined that. I also used to, when I'd have an episode, something related to MS, I'd write a little story about it. And that included bladder urgency. That's the polite term for you got to pee. So I actually wet my pants on live TV. I was on live TV. All of a sudden, I feel this warm feeling going down my leg, and I was cool. I just continued my report, everything else. Nobody realized I was there. Not even the photographer who was 3 feet away from me realized it. But the other good thing was it was raining out, so everything was wet. So I went back to the studio, I changed my clothes, and I wrote a story about it. And the story I wrote about it was in the story, I wrote my successes and my failures of making it to the bathroom. And I called the story Pissed Off About MS. So I thought that was might be a little harsh. So I showed it to my wife and she said, "You can't call it that." I said, "Well, that's what the story is." And so she gave me an alternative title and she called it To Pee or Not to Pee. Be a better title for it, a more gentle title. So that was it. But generally, in the early years, I had a pretty cavalier attitude about MS. I didn't, a lot of people didn't, when I would tell people that I had MS, they say, "You don't look like it." I said, "Well, what am I supposed to be? Looking, how am I supposed to look?" And they get embarrassed, and I kind of would go along. I take it. I was real casual about it, and not really because I didn't want to freak people out about it, and I didn't want to upset them. But I also, and in my book, I also talk about things that other people who have MS can relate, that are common to, because MS is different in everybody. But there are some things that are common. One of my things was I wanted to meet somebody else with it because I didn't know anybody with it when I was diagnosed. And I had no relatives with it. At the next few family reunions, I asked generally, does anybody, and most of them didn't know what MS was and had no clue, and there were no relatives with it at all. Although last year we went to a family reunion and on my wife's side, and one woman did have MS. And
Tim, can I interrupt you for a minute? We
sure,
started with the question, what changes have you made in your life to make your MS easier to live with? And I haven't heard any real changes other than the writing. Have you made changes in your diet? You did make some changes in exercise routine by going to the physical therapist.
yes, I do. In fact, I did when I sit at the computer, I usually have two lightweight dumbbells to
Mhm.
get my arms in a little better condition. Uh, because of my diabetes, very little sugar. I don't
Yeah,
do sugar that often, although
yeah.
I miss it. Uh, but it seems like when they tell you you can't have something, you want it more, and that's the case.
I have a
But
question for you. Do you find that if you cheat and have a little extra sugar, that it impacts your symptoms at all with MS?
not really. I don't
Because
find.
I find that pain really ramps up for me. My spasticity is worse. I'm not as cognitively sharp when I've sugared. So
I've, I've
that
found
is something.
lately though, when I sit, like when I'm watching TV at night, uh, have pain all over my body. I just have
Mhm.
general pain. And then when I get up, I feel like a tin man. I walk funny and everything else because my muscles are all tightened up.
I have
Um,
to think that's in part aging as well as
that
MS.
too, exactly.
I,
That's a
I
big confusion. Is it because I hear things pop that didn't used to pop, and I look in the mirror and I see my dad looking back at me.
yeah, same
That's
here. Bernie, do you do anything lifestyle wise to make your symptoms more easy to manage?
So, besides the exercise and my diet program, I'm also a veteran, so I have easy access to physical therapy. And I usually plug in with them once a year at least and let them see how I'm doing and suggest anything else that I may do. And when I do see them, I usually go for 4 to 6 weeks, on a weekly, couple of times a week until they discharge me and say, okay, you're on your own. But I usually hook up with them like once a year just to
Yeah,
keep at it.
thank you for your service.
Oh, you're welcome.
You started out as a medic and then went on with the GI Bill to get your nursing degree?
Exactly. Yep. Yep. I wanted to say I was trying to get into physician assistant school, but at the time I was told that there was too many female personnel in the medical field, so they would not allow me to stay in the medical field. So I decided to get out and do it on my own, and that's what I did. Yep.
Thank you. How about you, Seth? Any lifestyle changes that you found to be helpful?
Yeah, actually, I'm pretty compulsive about exercising. I actually am able to see a physical therapist weekly. There are ways of getting that approved with MS if you have Medicare. They just have to know how to send the information in to get approval. But I've got maintenance therapy, and I also am using protein shakes for exactly the reason that Tim was commenting on. You can lose weight, but if you're losing weight because you're losing muscle, it's counterproductive. Actually, you need to maintain your muscle. So you have to be careful that you don't go on a starvation diet that then loses you strength. So I'm very careful about A, exercising, and B, seeing my physical therapist on a weekly basis. And I when I go to see her, she's often telling me that I have to cut back on things because I'm so aggressive with my exercise. I usually do about an hour to an hour and a half a day. Um, but she intervenes and says when you're starting to get fatigued or you're getting trouble, it's counterproductive. You're going to be using different muscles that are not going to necessarily be working properly, and they'll learn bad patterns. So it's a matter of combining exercise with common sense and
Mhm.
good protein intake so you don't lose muscle.
We do have a couple of questions in the Q&A. We are not answering questions from the chat unless they're coming in from Facebook. Facebook Live. So if you do have a question for any one of the four of us, please tick it into the question and answer. Um, I have one hand raised with a question as well, but I want to take these two questions from the Q&A before I get to the raised hand. Wendy asks if I am still on rituximab, and if not, why and what am I on now? I'm not on Rituxan since June of 2023 because I had gotten COVID twice in the course of 2 months. My B cells were so suppressed that I wasn't getting any real benefit from the vaccine. or from immunity from having had COVID. So I've had COVID 3 times now and no antibodies to COVID at all after 3 infections and after 9 doses of vaccine. I excuse me, I am now on Pemgarda, which is every 3 month infusion that is approved for emergency use authorization by the FDA for those of us who are immunocompromised. And that my husband had COVID a month ago. And even though he didn't tell me that he was symptomatic for a couple of days, we were sleeping in the same bed together. I never got it. So he went upstairs for the next week and we masked when we were around each other, and I never got it. So the Pemgarda seems to be working for me. This past spring, I started on Mavenclad, so I've got my first year of Mavenclad completed, and we'll be finishing that up in the spring or early summer of 2025. So that's to answer Wendy's question. Kathleen says that she's a bit different. She was diagnosed at 71, is 72 now, had a hard time being diagnosed because of her age. She's on Ocrevus, but Aubagio is being considered. She goes to the gym 3 times a week and has started planning for travel again, is going for pelvic floor therapy. Pelvic floor therapy, for those of you who are listening who are having problems, particularly with incontinence, or even if you're having trouble with sexual performance, this may be something that could be helping you. Most MS centers have a pelvic floor therapist on their staff, and also spinal cord injury centers do. So that was just an informational thing from Kathleen. Mary, I'm going to allow you to talk if you want to come off mute and share with us what you wanted to ask.
I
Hi.
had, hi, I have had MS since 78, which is hard since I'm only 20, but I am 75 and I exercise 4 days a week, have PT 1 day a week. I have been on Avonex, Copaxone, probably 4, and I'm not on anything now. I finally decided at my age, what happens, happens. I am the group leader of an MS support group. I was on the MS board for 16 years. I have been a serious volunteer for the MS Society. So MS has become a great part of my life. And even though I'm not dancing anymore, such is life. I don't mind MS. I've gone from a cane that I named Frasier after the TV show Frasier Crane, and then I went to a walker which became Jerry Jeff for Jerry Jeff Walker. And now I use a scooter, and my scooter is named Scooty Puff Jr. from a character on the cartoon show Futurama. So
Thank you, Mary. Mary, Thank you very much. I think Mary brought up a very good point here that when we learn to embrace things that we really can't do a whole lot more about, it makes life a lot easier. So I really appreciate that. We have an anonymous attendee asking a question for Seth. What kind of shakes?
I don't want to, it's not that I want to be cagey. I honestly, off the top of my head, don't know the brand name. It's a wheat-based protein shake that I take several times a day. There are various different ones available. You just have to make sure how many grams you're getting. It's usually, for my shakes, 25 grams of protein per shake. And in terms of the shakes, they come in all sorts of flavors. If you like chocolate, they're chocolate. They have vanilla. They have strawberry. You can pretty much decide which you like best. And actually, I look forward to them because I do like chocolate. So
Thank you. Um, one of Patty mentions that Qigong is very helpful to her and meditation is priceless. She's 70 and was diagnosed in 2015. Um, Catherine's asking, what are you doing about COVID residuals, no taste? I never lost taste and smell with the last two episodes of COVID. The first one, I did lose taste and smell for just a few days, and then it came right back. However, the last episode of COVID that I had, I did have long COVID with it. I had a cough that continued for 6 or 7 months. I had shortness of breath on exertion during all that time. Cog fog was terrible. I found that it was really tough to sound like I had any intelligence at all when I was speaking with people. Um, and I did mention that to my neurologist when I saw him about 6 or 7 months after the last COVID infection, and he started me on IVIG monthly. And I noticed after the first month, a lot of the pain that I was having was ramping down. After the second month, I noticed some mental clarity returning. And after, I think, 6 months of the IVIG, all of the long COVID symptoms were gone. So if you're experiencing something long COVID wise, it might be a discussion you want to have with your neurologist. So we'll tick that one off. Judy says, any comments on new diagnosis of MS in your 60s or 70s? Is it more progressive? It can be, but Seth, why don't you take that question?
yeah, it can be. And actually, one of the concerns I had for a while was that there was this new trend that many people were not being offered medications because of their advanced age. We all know, those of us who watch the literature, that people often, or not often, it's not uncommon, I would say, for people to first develop MS in their later years. So you can be over 60, over 70, over 80, and still be having an acute MS, so that the concept of, oh, you're too old because your immune system isn't as active scares me, because that may be a true fact in general, but it shouldn't be a reason not to be put on medication. And I think it basically the concern that I have is that as the insurers get more aggressive, they may, hopefully they won't, but they may try to impose an age limit on who they'll allow to get medication. But so far, we haven't seen that. I'm very vigilant to make sure that that doesn't happen.
Yeah, I had my last really serious relapse when I was at 62. because my doctor said I'd been pretty stable on my medications, did I want to try coming off medication? And it was not a good decision. So I do encourage people to listen to your bodies and to have your doctors listen to you on that. Karen has her hand up. Karen, I am allowing you to talk if you want to come off mute and ask your question.
Yes. Uh, what kind of medications did you say you were taking now that you're in your 70s?
I went off Rituxan when I was 71, and now that I'm 72, turned 72 this year, I'm on Mavenclad, which is often used as an exit therapy as those of us are getting older. There are generally two drugs that are being considered for those of us who are aging kind of out of the worst of our MS symptoms, and one of those is um, teriflunomide, which is also known as Aubagio, and the other one is Mavenclad. And
Mavenclad. Okay.
yeah,
Um,
they're both oral medications. The Mavenclad does suppress your immune system to a degree, and therefore there's a concern of opportunistic infections, and there's also a concern of an increased risk of some cancers, particularly things like lymphomas or leukemias.
oh,
Um, that has not really been borne out in the use of these drugs in the older MS population, fortunately. Um, they, there's a whole list of potential side effects. And if you use your list of side effects to drive your decision whether or not to take medicine, I think you're cutting off your nose to spite your face, because I had not one negative side effect with the Mavenclad. So Mavenclad, you take um, a round of pills every single day, well, 5 days for a week. And then a month later, you repeat that. And then a year later, you repeat that cycle. They usually check your labs between the two doses of medicine. And again, after about a month after the second dose, because that's when you're going to be most suppressed, the second week in that first year. My labs did not drop. My white count did not drop as we would kind of expect it to drop. So don't use, don't use the side effects to drive your decision. Have a real interactive conversation with your
yeah. Well,
neurologist and let them kind of tell you their experience with it.
yeah, my neurologist tends to not want to give any more medication to me because of my age. I'm a year older than you. I'm 73. And he tends to not want to give me any kind of medication because of my age. I'm also a breast cancer survivor, but I don't know if that plays into it as well. So I don't
Does
know.
it does.
I know
If
it
you're a
does with
breast, yeah, with
um
Ocrevus,
Ocrevus,
yeah,
definitely.
yeah.
But I didn't know it was an issue also with Mavenclad.
There's such a small increase in the risk if you're a breast cancer survivor for these medications. It's minuscule. It's like 1/1000% increase in the incidence of breast cancers. But that's a risk you need to discuss. The teriflunomide, which is a daily pill, Aubagio, uh, could be difficult if you're on Medicare because the copay tends to be very high. However, Mark Cuban's Cost Plus has that particular drug in the 7 milligram doses for I think $26 for a month's supply, and in the 14 milligram dose for something like 36 or $37 for a 1 month supply. Usually they start you out on the 7 milligrams, and if you tolerate it well, you go up after a month to 14 milligrams.
And that's a Baggio.
That's a Baggio.
And
Or
that seems to work better with older people.
it does tend to work very well with those of us who don't have more aggressive forms of the MS. Yes.
My mobility is kind of shot, so I don't know if that plays into it. So
Well, that could be partly age again as well,
yeah,
and
I'm sure it is. But
physical
okay.
therapy may be helpful.
Yeah,
Thank
I
you,
just
Karen.
came off of physical therapy back in the spring, so
Okay. You want to mute
okay.
yourself again, Karen?
Thank you very much. Thanks for your explanation.
Thank you. Um, I just want to see if we've got anything from our Facebook Live feed that's in the chat, or if it's just people chatting. Um, I don't see anything Facebook Live. So, Bhavya, if there is, oh, wait a minute. Connie from Facebook asks, do you all have an MS specialist as your neurologist? How do I find one in my area? I do. Um,
Yeah.
Seth does.
Definitely. Even though I'm a neurologist and I treated MS for many years, um, uh, basically, if you try and be your own doctor, you have a fool for a doctor.
Yeah.
So I put my care in the hands of an MS specialist. Yes.
Mine's not an MS specialist. She's just a neurologist.
Okay. I recommend strongly that everybody with MS be seeing an MS specialist and not a general neurologist because they just don't have the training to treat
Mhm.
MS. Um, and you deserve better. So, in some areas we are in a sort of a neurology desert, so it's hard to find somebody that's trained in MS specifically. I do before we had as many MS specialists as we do available, I used to tell people, check with the neurologist's office that you're hoping to be seen by. If they've got at least 500 patients in their neurology practice that have MS, they're probably up enough on the current treatment. But that was back when we had like 3 or 4 medications that were available. We now have more than 2 dozen. And they work in vastly different ways, and a general neurologist just can't keep up with that. So, as far as finding, if you, Connie, if Connie sends a an email to info@mscare.org, that's the Consortium of Multiple Sclerosis Centers, give them your zip code and ask them who in your area or how far from your nearest MS neurology clinic. Um, they will send you a list of doctors that are credentialed to treat multiple sclerosis.
What,
Um,
you were asking, was there anything I do differently
mhm.
because of my MS or to deal with it? I try to stay out of the sun. And it's kind of ironic that here in San Diego, we have sunny day. The year-round temperature is 72 degrees, sunshine almost every day. And playing golf, there's nothing but sunshine. So it's a
Mm-hmm.
matter of dodging the heat and the sun because I have been kind of overwhelmed by the sun on occasion when I'm playing golf. But it's ironic that I live in this kind of climate and it's bad for my MS. Most people would love having this type of situation. Uh, it's It got a little funny, but I still like it. I don't want to live anywhere else anyway. I
Does
like
the heat seem to bother you, or is it just the sun that you're concerned about?
on occasion heat does the heat
Okay.
and
Yeah, I tend to be indoors in hot weather unless I'm outside for brief periods with a cooling vest. Gus from Facebook asks, are there any signs that you will have a mild form or aggressive form of MS as you age and time passes? I think uh, men tend to be a little bit more aggressive than women with MS. Um, if you are a smoker, you can expect to have a more aggressive form of MS. So if you don't want to have an aggressive form of MS, don't smoke. Um, as far as that's concerned, I had a very aggressive form of MS in my 40s and 50s. And once I got onto a disease-modifying therapy that my system responded to, that aggression just calmed right down. So I would say, you know, if you're having a lot of spinal cord lesions, you're more likely to have a little bit more aggressive form of MS. I'd just be really careful, not assume it's MS if it's a lot of spinal cord lesions, and make sure that you've also been tested for neuromyelitis optica spectrum disorder, also known as NMO. It can look like MS. For years, it was diagnosed incorrectly as MS. We now have a blood test for it that's positive in about 75 to 80% of the cases of people that have it, but its lesions look slightly different on MRI than those who have MS. We're just about at the top of our hour. I just wanted to ask the three of you if you're able, if we've got extra questions, to just stay on the line for a few minutes, or if we have some time constraints.
I'm good to stay on. The only limitation is I'll probably take a minute to go to the restroom, but other than that, I'm fine.
Don't we all?
Yes.
You're
Yeah.
welcome to do that. The other thing, Mary mentioned to check with the National MS Society for referrals. If you go to the National MS Society's web page, they have a physician locator. Now, the physician locators, the physicians that are in that locator, you type your zip code into that, they're not necessarily all MS doctors. Many of them are general neurologists. I would far rather get the information from the Consortium of MS Centers because we know that those doctors are getting regular MS education through the Consortium of MS Centers. So again, the website for that is www.mscare.org, and their email to try to locate somebody is info@mscare.org. So that answers Catherine's question. Let's see. Uh, all right, so Kathleen mentioned as far as the heat sensitivity is concerned, see if you can get a cooling vest free from the MS Foundation. Also look into a Misty Mate. Those you can pick up at Target, Kohl's, things like that. Maybe even Marshall's or TJ Maxx. The free cooling vest program that the Multiple Sclerosis Foundation runs is only from February 1st to June 1st every year. And we do give cooling vests away to people who have not gotten them from us within a 5-year period. The MS Association of America also has some funds for free cooling products. And there are several websites that will give you discounts on cooling products if you let them know that you have MS.
I have a cooling vest that I wear when I play golf sometimes. I've also have had several other cooling devices. I had a wrist. It was a cooling wrist. It had like a chemical in it in the refrigerator, and you wear it and it cools your whole body. It's pretty good for that. My cooling vest, it has pockets in it on the back, and you put an ice pack in underneath. Not ice cube, because ice cubes melt, and your shirt gets soaking wet by the time you're done. But I have a cooling vest as well, and you can get cooling hats too, and bandanas, all which are available. And I think the MS Foundation has those too. My wife bought me the cooling vest last year for Christmas,
Mhm.
And it's pretty effective. It does cool your whole body very well.
Yep.
But I've done that quite often. But I also try to stay out of the sun, get in the shade as often as possible.
And hydrate well.
Oh, water's my best friend.
Now, Sharon is asking Seth what kind of specific exercises that you do, and I want to respond before you do and just say, Sharon, there is no one exercise that is good for everybody. You need to see a physical therapist to tailor those exercises to you. And take it away, Seth.
I have a broad spectrum of exercises, and it'll change week to week based on what my therapist is seeing as my needs for that week. It is, I have a neural sleeve, which is basically a stimulator for my weaker leg, which is the left leg. And what that is it's a lot of electrodes that stimulate the individual muscles for ambulation or for exercise. And I do a full battery of leg exercises because my legs are the weaker component here. And I also do about 35 to 40 minutes of elliptical machine every day. And as I said, I'm walking a lot outside. I go to stores probably 3, 4 times a week to just pick something up, put it in my backpack, and get the time outside. I truly do feel that my devotion to the exercise, which was early on, has allowed me to maintain walking function for a longer period of time. And part of that is the concept of neuroplasticity, which you all probably have heard before. The concept being that if you lose function, such as you have a stroke or you have MS or anything else, your nervous system may actually realign itself to get you to activate muscles in different sequences so you can do things that you have lost from the disease. And I do it because I want to give my brain the feedback that it needs to allow for those recalibrations of the pathways so I can maintain function. Obviously, nothing will prevent it from totally going at some point, but I'm trying to maintain as much as I can that way.
Thank you. Lisa mentions that she has intense pain in her left hip and groin area. Ortho doesn't want to do surgery for fear of infection. What should she do? She's 62, has RRMS for 20 years. She takes Mazent and her MS is stable. I don't know why the ortho would not want to do surgery for fear of infection. Mazent does not suppress your immune system. So it would not put you at any greater risk of an infection than somebody that didn't have MS. So I think it's time to get another orthopedic opinion.
Yeah.
Hip or groin pain generally is where if your hip needs to be replaced, you would have the hip pain rather than in the bursa or the outside of the hip. That pain in the outside of the hip is generally related to a gait disturbance, which can be helped with physical therapy. I've had decades of outer hip pain, and physical therapists are wonderful with working on that with things like ultrasound and cupping and red light therapy and things like that. It can really knock the pain down quite a bit. So I would say a physical therapy appointment is warranted, and also I would get another opinion from an orthopedist on that.
Yeah, can I jump in there? Because I had not quite the same, but a similar experience. I had extreme shoulder pain that they couldn't figure out what was causing it. and I was hospitalized. And because of my MS, they really didn't want to do anything. And they came to my room and said, "Well, we could put a needle in your shoulder to see what's going on there, but that hurts like hell. You don't want us doing that, do you?" And I realized that I needed a diagnosis here. And I said, "Yes, I do. I want you to do that." And sure enough, they found a focal infection, which they were able to debride and then put me on uh, antibiotics for 6 months for sepsis associated with that. So, I think that you really need someone, 62 shouldn't be a reason why you shouldn't get evaluation of your pain. That doesn't make any sense. And I agree with Cherie completely that you should be perhaps seeing a second opinion on that one.
Anna says, are Mayzent and Ocrevus equally effective? Not even close. Mayzent is the only drug that has been approved specifically for secondary progressive MS. It can reduce some of the inflammation and keep you going a little bit longer. Ocrevus is probably Ocrevus and the drugs like it, Rituxan, Truxima, and Briumvi, and also Kesimpta, are at the moment the most effective drugs that we have on the market. They do suppress the immune system, which means you could be at greater risk for infections. I have not found that to be the case other than with COVID. I never get colds. I, occasionally I'll get a urinary tract infection, but I think many older women do. So there's not even a comparison to the effectiveness of those two classes of drugs. Let's see here. We probably need to kind of get ready to wrap up. I just need to take a look at my email to see when the next event for us is. In the meantime, Seth, I have a question for you while I'm looking that up. Could you just, because you do advocate on the Hill occasionally, could you just share some brief thoughts on what that advocacy might look like or how it might change as we move into this new administration? There's a lot of conversation right now on our Facebook pages with concerns about that.
Yeah, well, I think that getting the funding for research and for MS care and any chronic disease care is always a bit problematic because everyone's trying to cut back on spending. But what I would say is, even with uh, a new attitude on Capitol, or rather in the White House and also on Capitol Hill, I think that the elected officials, I won't say all of them, but certainly my elected officials are very responsive to my requests for support. The problem is going to be how much pushback you get, and I'm hopeful that the advocates that we have on Capitol Hill will continue to support us. Any chronic illness and MS is not a partisan issue. And I think you just have to present your personal story and reasons why you want something done. And it's going to be hard for those that go to these hearings to say no without getting some pushback from their constituencies, even if they've had a major show of support this round. I mean, they're constantly looking at what's going to keep them in their office. So I think that continuing to do what we do is just push back, and we're going to have some successes and we're going to have some failures. And what I've got to tell you, after having done this for close to 20 years, You can't get too low when you have a failure, and you can't get too high when you have a success. I mean, I think it's a balancing act, and I don't see this as going to be a complete overhaul to the point where we don't get any coverage. Even if the more conservative individuals want to do that, I just think there's going to be enough pushback both from within the majority as well as in the opposition that it's just I just don't see that happening.
Thank you. I will say that because there's been so much concern expressed in the last few days since the election results came in, we at the MS Foundation are working on some tools that may help the individuals living with MS to know who to write to, how to speak to them, um, letting them know that you're a real person, that this is not theoretical, and what it would look like if you didn't have access to the tools and the medication that you have now. So
Yeah.
we're working on that.
Yeah, the MS Foundation has been great doing that. The MS Society has been good in doing that as well. It really is a very strong population out there of people who maybe they just write a letter, and actually these societies will help you write that letter and personalize it. And if you need support from editing, they'll give you that. There's no charge for that. And it's just a matter of being you don't have to be a politician. You have to be an individual, a citizen, someone who is living with a condition, and you just have to raise the flag and say, I need help here, and this is why. And as I say, it's hard for them to say no to that approach. Some will, but I think it's harder to do, frankly.
Last,
All of our senators and representatives have healthcare staff within their offices, or people not maybe not trained healthcare professionals, but they have people that really look out for us as far as our healthcare needs. So make those needs known to your representative, to your senator, um, and granted, for some of us, that's going to change come January 2nd, when the new House and Senate are sworn in. It may change some on January 20th when the next president is sworn in. But I don't think we're going to see as big a change on January 20th as some people are fearful of as far as this particular item is concerned. Um, November is National Family Caregiving Month, so many of our webinars moving forward through the rest of this month are going to focus on caregivers. This coming Thursday at 4 o'clock in the afternoon Eastern Time, Nicole Goebel will be doing a webinar on who is a caregiver. I think many of us, even if we're being cared for, are also caregivers to an extent. So come and listen to Nicole and join with her on November 14th, which is this Thursday afternoon. Um, and thank you so much to Tim and Bernie and Seth for the discussion today about how we've made it into our 70s with decades of MS under our belt. And done so with some grace and with some success. Thank you all very much. For those of you that are on Zoom, please stay online for a moment after we stop the recording. There will be a survey that will pop up that will ask you what you want to see in future webinars so that we can provide for you what you feel that you need. Have a great November. Stay comfortable. Take a deep breath and hydrate.